Hello, my name is Vincent Xu, and I'm a medical oncologist at Dana-Farber Cancer Institute. Thanks for this opportunity to talk a little bit about the quality of life outcomes on the CheckMate 9ER trial. As you're well aware, CheckMate 9ER established cabozantinib and nivolumab as a standard first-line treatment option for metastatic renal cell carcinoma. This adds this doublet, cabozantinib and nivolumab, to the standard list of combination immunotherapies in the first line setting, which include axitinib and pembrolizumab, lenvatinib and pembrolizumab, as well as ipilimumab and nivolumab, as well as axitinib and nivolumab, which is rarely used because that trial didn't show a survival benefit. So, in thinking between these different treatment options, all of which are common and reasonable in someone with kidney cancer, quality of life does come up because many patients will ask about the impact that this treatment will have on their ability to go through day-to-day activities, but also their ability to not have, importantly, deterioration from their disease-related symptoms, because many patients often are symptomatic from their cancer when we start treatment. So how does cabozantinib and nivolumab compare to these other treatment regimens? Well, the CheckMate 9ER trial compared cabozantinib and nivolumab randomized against sunitinib. Prior data releases have shown that cabozantinib and nivolumab improved progression-free survival and overall survival, which was the basis for its FDA approval in the first line. However, what's really unique about this data is that cabozantinib and nivolumab is the only combination IO-TKI therapy in first-line treatment of RCC to have also shown a quality of life benefit compared to sunitinib. The other IO-TKI combinations have released some quality of life data and generally have been sort of similar to sunitinib, but Cabo-Nivo actually showed superiority, which is a real distinguishing feature of this regimen. Quality of life in this trial was assessed using two questionnaires, and these are both standard quality of life questionnaires that have been evaluated in multiple trials. One questionnaire really focused on kidney cancer specific symptoms, whereas the other questionnaire was more of a generic cancer quality of life questionnaire. The take-home point from the quality of life analysis was that quality of life was maintained on cabozantinib and nivolumab overall during treatment, whereas quality of life tended to deteriorate more on patients who received sunitinib. In addition, patients who had disease-related symptoms tended to have improvement of their disease-related symptoms on cabo-nivo, but not on sunitinib. This data can really be helpful when counseling patients to talk about what to expect after treatment. And I generally tell patients the goal of treatment is not just to shrink their disease radiographically, but to maintain their quality of life. And folks who are physically active, folks who have a social calendar and need to see friends and family, I try to tell patients that we can make adjustments as necessary to make sure the quality of life is, if not better, at least not worse compared to before treatment.